all. Hope each and everyone is doing well and good. And it is me, Dr. Amrita here. So today I'm going to say about the most important topics on ENT. So Neet PG all set go. Isn't so? Yes, Neet on the basis of this Neet, you will think that ENT is going to be very simple. No, yeah, ENT is actually a very simple subject, but it is a most area where they can ask questions little bit tough, because if the examiner is going to make the exam tough, yes, you can definitely see tough questions regarding ENT. So we how can we can achieve and crack and knack all those questions. So this here I'm dealing with all important topics. I'm just going to say everything fast because I know that ENT, ear, nose, throat. So first of all, give importance to ear, because as much questions coming from ear part. So once you're planning to study ear, I will just say that guys, just study this hearing test wala. That is, they will be giving a clinical scenario. Usually, when you take from the previous years, every years there will be one questions. Like they will be giving, you will be knowing like which one, which side is like whether it's an SNHL. You will be knowing that Rini test, Weber test, that thing you study, and on the ways of clinical scenario, how to identify which one is that. Do as much MCQs related to that. And second one, you want to do about the audiogram. Audiogram, you will be knowing like a noise induced what happened. There will be boilers notch, like that. Autosclerosis, what will be happen in that audiogram. Perfectly, the diagram you should learn like 2000 hertz and all. You will be knowing that hertz notch. Please in and out learn. Okay, tympanogram, do MCQs related to that, as well as that cows, there is a mnemonics, will be like called what happened, like that. That's all. Please look. BPPV is going to be very important. And also, yeah, Bera is very important, because you want to study in and out. If they feel like to ask something new, you can expect questions from the Bera, as well as all machinery things like that's I will come. Okay, that tracheoesophageal speech, there is something that in 2024 they have asked like tracheoesophageal, what is that, tracheostomy they have given, and esophageal speech, there are certain things how they fix it, all those things. Please learn it now. Only I remember about that. Please learn those machinery parts very well. Auditory pathway, you will be knowing one mnemonics is there, that is ecolima. Please do learn. So first it is eight nerve, then comes the cochlear nucleus. How is that pathway? Just read and go. Very important. Then comes, yeah, Meniere's disease. That's all very important. Very important. BPPV, autosclerosis. There are a set of questions every time they'll be asking. So please study in and out, because these are going to be the repeated question. Then you want to like that's autosclerosis is very important. I have already told ASOM, CSOM. That surgery part is very important in a that how is the treatment part, whether there is like any medical treatment there. That's all you want to like canal up, canal down. What is the surgery? Where do you do a complete mastectomy? That's all in and out you want to study, because there'll be, you can expect one question from there. Actually, it's very important. Then about that, yeah, that's all you want to learn. Meanings is very important. Okay. Then comes to, yeah, nose. You'll be have that this what happened for what is about Ashley's forceps. Walsham forceps. Ashley's means A, that is angular wala. So that is SR, like septal reduction. The other one is for bone reduction. Please learn the diagrams, very important. In ENT, they can put some diagrams in as Q. Very important that instrument, just read it. Okay. That rhinosporidiosis, rhinoscleroma, that's all every time they'll be asking. So very important. That's clinical scenario. One guy go to like swimming pool, that pond wala, and he presented with us in a last mass. That's all typical questions. So what you see in rhinoscleroma, that is water cell bodies, McClure cells, that's all, just read and go. And also in 2023, they have asked a question like that is atrophic rhinitis. The key feature is what? Merciful anosmia. So they will put everything in a case scenario. Okay. So next, yeah, PNS wala, just do some MCQs related to that X-ray. What is it? Calvel's view and all those things. That views wala you want to look. That is, if it is occiput, what is a view, and all those things. Maxillary sinus, like that. View is very important. Then comes to vocal cord palsy. is very important in the view of INCT also. Okay, the thyroplasty, there will be like one, two, three, four. That is ML, SL. There's got like first one is medialization. Second is lateralization. That is that one, two, three, four. Thyroplasty you just learn. And very important is carcinoma larynx because the surgery part is going to be very important. That management part. So where do you give radiotherapy? Whenever this vocal cord is mobile, as well as the superficial exophytic. Whenever the lesion is superficial exophytic lesion, you will be doing what? Whenever the vocal cord is mobile, you can go for radiotherapy. Whenever the vocal cord is involved, you do the surgery. So please learn in and out. Laryngomalacia, all time favorite question. Yes, favorite question. Then yes, when you, yeah, throat wala is very important because just read about that cancer or that staging, just read it. And very important is subglottic stenosis, that myocotons, that one grading is there. That's very important. Every time, usually we see one question. Just before 3 years, there was a question. Please study this time. Also, we can expect one question. And about sublingual cyst, what is the management, like marsupilation. Sencke's diverticulum is very important in point of fear as well as in surgery. Very, very important. I don't know, it's just read that juvenile naso pharyngeal adenoma, JNA. JNA is going to angiofibroma. That is, JNA is very, very important. Nasopharyngeal adenoma, that's part JNA, very important. Where do you see Henneberg sign? That's all very important. Just do MCQs and see. Okay, laryngoscele is very important. Okay, laryngoscele, they will give what there is one sign is there, that is very, very important. Okay, very important. Then comes to, where do you see this laryngoscele is most commonly in trumpet blow, this thing blower, because of increased pressure they will be doing like this now. So that picture you want, and you want to know what sign is there, that's very important. Then that fracture vala, flow blood fracture, so what is the sign? Teardrop sign. So they'll be putting the x-rays and will be showing. And about carotid body tumor vala, very important. That's all signs. Aspergillus fumigatus, that x-ray they can put and ask you what is a fungal culture. There is one criteria, Benz and Coles criteria, very important. What is a drug, and all this they can ask you. And about the nerve is very, very important. That's about this glossopharyngeal and vagus, what supplies uvula, and where do you get the referred pain. There is a box. Okay, please read it and go. Very important. Acoustic neuroma, I have already mentioned, that's very important. ASM, CM, flip sign, where do you see? CCT, that is glomus tumor, you get it. That all nerves, well, please learn. Then there are certain triads is there, like Santos triad, Samter's triad, Trotto's triad, Gardenigo was what? Carton, yeah, last time they have asked you the typical they have given, because so many of them very confused. Like, yeah, Young's syndrome, what is like EMS, that's all. Triad wala, there is a, they have given like recurrent sinusitis inversus bronchiectasis. Where do you see like Cartagena syndrome, Kartagener, that's very important. That's Young's triad means what? Recurrent sinusitis, bronchiectasis. Always remember, young wala means what? Azoospermia. They will be very conscious about the sperms. So like this, you can say. Then comes to, yeah, Plummer-Vinson syndrome. That comes iron deficiency anemia. Ramsay-Hunt syndrome. That's all very important. The triad wala, last time they have asked, so you can expect one of the question from any of the triad they can ask. Like Grisenner's sign. Grisenner's sign is also very important. So these are the must know questions, and also you want to do the previous year questions. So when you do the previous year questions, I think less than 10 questions are. So when you do the multiple questions, you will be knowing that which one is very important. So it will be very easy for you guys. Okay. So please never lose your hope. Yes, of course, you can defeat this battle. And also, I already explained to you all guys, laryngomalacia, very important. That nodule, polyvocal cord, recurrent, all those things. This HPV, human papillomavirus, what is, how to identify. The vocal cord palsy, that is a recurrent laryngeal nerve thing. See, what happens when there is bilateral recurrent laryngeal nerve. That's all. Just read and go. Okay. Yeah, that's cancer. Voila, it's cancer. Larynx is going to be very important. Please never skip it. Okay. Then that sinus wala draining, where it drains like inferior meatus, like nasolacrimal duct, and what happened to sphenoethmoidal versus superior meatus. That's all. Just read and go. Very important. Where does it open? And that Mayor Cotton's this in classification. I have subclotic stenosis. That's very important because in 2021 also they have asked about the drug wala. So it is going to be very important. So every time they used to put here and now. So I think I will put it two again. I will put in two parts because my storage have got some problems. So I will put one and two part today itself, guys. So I want each and everyone to be happy. Never think about never think about the outcome. So always what you have is this moment. So always think about this moment and study well. Outcome and all God have already written for you. So just hope for the best. Difficult roads often lead to beautiful destination. Yeah. So enjoy your life. And it's me, Dr. Amrita here. If you're new to my channel, please do guys subscribe. Thank you all.